How to heal a broken bone quickly. A fractured bone. It's not a nice sight. Aside from the first therapy, plaster, surgery, etc., there are a few things that, in my experience, can help a fractured bone recover faster. Naturopathy offers valuable services in this area. In this video, I'd like to demonstrate the possibilities. What exactly is a bone fracture, and what does it imply? Of course, you've heard of a bone fracture. However, there are a few subtleties to be aware of, particularly when it comes to accelerating healing. A bone fracture, equals fracture, can occur due to a direct impact, e.g. blow or impact, at the affected site, an indirect impact, e.g. leverage effect at a site far away from the impact, repeated impact of small damages, equals fatigue fracture, or in the case of pre-damaged bone tissue, equals remote metastasis of a cancer, without a suitable causal impact, equals pathological fracture. There are closed fractures where the soft tissues and skin are unharmed. Skin and soft tissue injuries of different severity occur in open fractures, impaling of the skin with bone fragments, tearing of the skin with a large skin wound, destruction of the skin with muscle, tendon, nerve or blood vessel damage, up to complete or incomplete amputation. There are certain fracture indications: deformity, greater mobility, bone friction equals crepitatio, visible bone pieces, and doubtful fracture signs to detect a fracture: swelling, bruising, pain, impaired function. Radiography is an important tool of detection since it generally clearly indicates a fracture. Nerve damage and nonspecific symptoms such as shock can be significant concomitant indicators of fractures. The length of time it takes for a bone fracture to heal. Ossification does not commence until the 4th to 6th week if the bone was fully fractured through. Only during this period are the tissues generated up to that point converted into hard, lamellar bone. However, the healing process is dependent on the patient's age and ability to regenerate. As well as the fracture's location, some bones just have a greater blood supply or can be immobilized more effectively than others. If treatment does not go well, the recovery time can be as long as 12 weeks. If things move swiftly, it will take 6 weeks. It takes much less time with children, 4 to 8 weeks. Possibilities for a speedier healing of a bone fracture. Of course, the following procedures can only be considered to shorten the healing time of a bone fracture. Diet. Avoid anything that promotes the organism's hyperacidity. Consume a healthy diet. Homeopathy. Arnica D4 and Ruta D4 are used to prevent problems and promote correct healing of wounded arteries, tendons, tendon sheaths, periosteum, and nerves. Arnica administration typically lasts a week. Ruta should be avoided for at least 2 weeks. In the case of nerve involvement, add hypericum D3, in each case, 5 drops 3 times daily for at least 3 weeks. Symphytum D2 for 6 weeks for faster bone development. Massages for medical purposes. Manual lymphatic drainage aids in the removal of cellular detritus and metabolic waste. This allows the blood to transport more oxygen and building ingredients. Orthomolecular medicine is a branch of medicine that focuses on the Mo. Ca is for calcium, F is for fluorine, V is for vanadium, Mn is for manganese, and Co is for cobalt. Bergerstein dolomite has a balanced ratio of calcium and magnesium. Manganese is also necessary for the creation of bones. Acid-base equilibrium. Many acute and chronic problems can be attributed to acid-base balance and the issue of hyperacidity. Chronic complaints are a factor. Schuessler et al. Calcium fluoratum D12, calcium phosphoricum D6, ferrum phosphoricum D12, Silicea D12, natrium chloratum D6, 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 natrium chloratum D. Other. Magnetic field therapy has also been shown to hasten bone repair. Thank you for watching, and we hope you will give us a thumbs up and subscribe to stay updated.